Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio on a very beautiful, gorgeous, stunning Washington day. 888-630-9625. That's 888-630-WMAL. That's how you reach me here on the station. We are one day post Ageless Health 2012. It was an amazing, amazing event. One that most of you who attended will probably never forget. It was probably the best production in the 12 years that we've been doing it yet. And each presenter, each delivery was consistent, was on time, was over the top, was highly dramatic and very powerful. I have a wonderful opportunity to work for some dynamic, highly capable professional people in my practice. And when it all comes together, when something like this comes together in the way that it did yesterday, it just makes me so super proud of everybody that I have had the opportunity to work with to make this happen for you. And that's why we do it. And that's what I said yesterday. We do this program every year, Ageless Health, for you, to bring you information, to position your empowerment, if you will, to take charge of your own health. Health is a do-it-yourself program. You must be the captain of your ship, and that's what we try to get across yesterday. Each presenter, from starting in the morning, we positioned it. We talked about the triad of health, structural, chemical, emotional. We talked about decision-making processes in your health and your wellness, what that really meant, the commitment level that you had to have for it, how to really put that in place. And then the next speaker was Dr. Scott Lamp, and Dr. Lamp talked about diabetes, cardiovascular disease, and so forth, and how it comes about because of the stresses of our environment, of the things that we put in our body, the things that we're exposed to, the things that we should be doing that we don't do, and unknowingly how and unwittingly this builds up over a period of time. Then Dr. Jennifer Sims spoke on female hormones, and it was very well connected also for men as in addition. And then after that, Dr. Stephanie Pina talked about your body's all energy and how we interconnect energetically to everything in our environment. Sue talked about diet and nutrition and how you can eat well on the run in this crazy, stressful world that we're in. It was powerful. Chinese Martial Arts Institute did a demonstration on Tai Chi, and it was done so beautifully. The food was organic. It was great. It was evidence. Erin Roselle Poe, my daughter, did a on-stage demonstration and engaged people during the registration period for exercise, and showed you how that core training is not impossible, that anybody can do it at any time. In the afternoon, Dr. Evan Mladenoff, my dear colleague and friend from Kansas City, did a great presentation on the emotional side of healing, and it was off the chart. He's funny, he's engaging, as he always is. And then we came in, Dr. Browning, the professor, talked about pain patterns and how the body works neurologically, and talked a lot about these inflammatory agents, the cytokines, and what that really meant and how they come about. And then as we went through the afternoon, Dr. Poe, and then we concluded and we wrapped it all together. It was over the top. Thank you, and I thank all of you for attending. We were at capacity. It was a great day, and now we'll rest for a week, and then we'll bring it back together. 888-630-9625. Let's talk about your issues today. I have several things I'd like to talk about. You've had a problem. Let's see if we can put the fire out. Let's see if we can make a difference. That's why I'm here. That's why we do what we do, and we do it with love for you. Things that are in the news are kind of interesting these days. There was article that was written and published in the American Journal of Clinical Nutrition. And, anytime you talk about olive oil, you get my attention simply because of my love for the substance, but also because of the fact that, I'm Mediterranean, and that's what olive oil is all about, right? Well, mostly anyway. I can use the excuse anytime I want to. But here's the deal. The American Journal of Clinical Nutrition published an article, and what they did was they did a comparison study between the intake of olive oil and the risk of dying over a period of time. And what they found that the more olive oil, or percentage-wise, that you consumed, clear, clean, dark virgin olive oil, that on an average, people had a much lower risk of dying from anything. And they did this study on an average of 13 and a half years, and they followed this up. The research was very significant. They analyzed over 40,000 men and women who were aged 29 to 69 years of age, and they recruited these people into this study, and it was amazing how they went through it. The interview responses concerning foods and drinks, and they were consumed, and they analyzed the content of olive oil, and as it compared to the amount of calories that they took in over a period of days and so forth. Over the period that they were studying between 1992 and 1996, and also ending between 2006 to 2009, there were 416 deaths from cardiovascular disease, 956 cancer deaths, and 417 deaths from other causes. Participants whose olive oil intake was among the top 1/4 showed 26% lower risk of dying from any of the things that we just talked about, and a 44% lower risk of dying from just specifically from heart disease. It was quite a study and very evidence, and obviously 44,000 people in a study is a significant study, and over a long enough period of time that you can actually draw some conclusions. But those are the things that we're saying. Your omega-3s that you have to have, the omega-9s that you have to have, and the omega-6s that are inflammatory triggers have to be in balance in your body. And if they are in balance, plaque does not form. Now, are there holes in the study? Well, it depends. There definitely, this was a study and not an experimental double-blind situation. So, you can go in and you can begin to kind of compartmentalize it. But there's so many other things that are out there. There was a trial that was done with resveratrol. And, we kid about resveratrol being a glass of wine, but actually in concentrated forms. And this was done at Georgetown University in conjunction with 25 other U.S. institutions. And what they were looking for is the relationship between resveratrol and Alzheimer's dementia. Now, yesterday at the Ageless Health Conference, Sue talked about the increased risk of Alzheimer's with those people who eat a lot of fast-acting carbohydrates and sugars. It's overwhelming. It's over the top. So when you look at little things that can make a difference, but the overall dietary pattern is important. But what they did with this study that was done at Georgetown, they assigned 500 milligrams of resveratrol and or a placebo, so it was in fact a double-blind study, and the dosage to be increased over 13 weeks up to a maximum of 1,000 milligrams of resveratrol, and they did that twice a day. And then they did lumbar punctures and MRIs of the brain and so forth, and tested blood and tested urine. And, the researchers are looking to absolutely factually determine what the pathways are that are supported in some ways and inhibited others to stop the progression of Alzheimer's. And the jury's out, but the initial study and what they're finding is that there's a tremendous link between resveratrol intake and consumption and dementia. So, when we get all the data back on that, we'll let you know, and we'll try to put the pieces together so we understand it and you do as well. 888-630-9625. Perhaps you've had a problem. Let's see if we can put the fire out for you today. Love to talk to you on any subject you have in mind. We're coming up with another very special event, November the 27th. Mark it on your calendar. November 27th. WIDA will be airing Ageless Health, the documentary. We are so proud of that, and put it on your calendar. It's a Tuesday night. I think the airing is at 7:30, but check your local channel. It'll be airing in Maryland, Washington, and Virginia, their broadcast areas, so it's going to be quite significant, quite powerful. It's based on the concepts of my book, Ageless Health. Health is a do-it-yourself program. And this has been in the making now for a year. And we are extremely, extremely excited, and hopefully you will be after you see it. You'll get to meet 6 people who were given up medically, basically told that there was nothing more that could be done for them, and they chose to do integrative therapies from the triad of health, structural, chemical, emotional, dealing with the neurological system through chiropractic, applied kinesiological pathways, acupuncture, nutrition, and the reversals, the miracle turnarounds will be shown on television, and it is so exciting that, we sit there and we look at this and say, really? I mean, this stuff works. It's amazing. So mark it on your calendar, November the 27th. Join us, and we'll be sitting there watching. I'll be live during the breaks and talking about Ageless Health, and, hopefully this will be a key to springboarding your own initiative, if you will, into changing your life the way it's meant to be. Because, you have the ability, you have control. In the world that's coming around starting next year with the full implementation of the Affordable Care Act, well, let me tell you something. If you think somebody else is going to take care of you, you got another thing coming. You really have to begin to analyze, assess, and take control of your own life, of your own health. Because if you don't, your morbidity, the quality of your life is going to dramatically decrease, and there's not going to be a whole lot left for anybody to fix. So as long as you're breathing, and you've heard me say that many times, you can fix virtually anything. Your body's extremely forgiving if you're willing to commit 100% to your wellness quotient. You have to be the driver. You have to be the one that says, okay, it's time, I'm going to do it, and really step up to the plate. Because until you get that leverage, until you get, I'm not going to take it anymore type of attitude, you're not going anywhere. You're not going to be able to, repair. You're not going to be able to fix. You're not going to be able to excel and exceed to the level that you have a natural birthright to do that. I want you to go online. I want you to go to a new website that we've developed for your interactive learning. It's called drtomroselle.com. So it's just drtomroselle.com. And the website is designed for you to be able to go in and do webinars and online learnings and subscribe to blog sites and emails and so forth. We've designed this for you. We've designed this to continue the educational process from Dr. Tom Roselle Live, also the things that we do at the Roselle Center for Healing, and it's all wrapped up into one fine, very supportable capsule of learning for you. So check it out. Let us know what you think, and go back frequently. Tell your friends about it, and let us know what you'd like to see there, because, again, we've designed it for your educational process, and it's one that we're totally committed to. We're committed to helping you when you come into the practice. We're committed to educating you outside the practice. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio on this gorgeous day. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We've got a couple things that we're hashing over. We're going to take you through some steps to really increase the index of your wellness quotient, if you will. And I'm going to show you how to do that step by step. Kind of very simple things, but if you realize that they are so simple, you really need to start like today. So we'll get to that. But first, let's go to the phones. Jay, how can I help you?
Well, hi, doctor. I appreciate your show.
Thank you.
I have, I'm 66. I'm overweight. I'm 5'5", about 210, which is down some, but I'm doing alkaline water. I have a machine from Japan, the one that works. I try to...
Kagan machine.
But I've got all these... first I had these pains behind my knees, and it was times 10 of any pain I've ever had. I started drinking a lot of water, did the lemon juice a nectar flush.
Is the pain isolated to the back of your knees, Jay?
It was.
Now, does it go down the legs or does it go up?
Well, it's that part, the really bad part, seemed to stop from trying to drink 160 ounces of water a day, and maybe the flush. But what it's happened, it's now more like electric shock type, maybe fibromyalgia type.
Okay, well, let's not try to diagnose it. Let's figure out what the pain does. Is it worse when you're standing, when you're laying down, when you're walking upstairs, when you're walking downstairs?
You know what? It comes out of nowhere.
Okay, so it doesn't make any difference position. It doesn't make. Okay, so that tells me that there's a mechanical imbalance within the knee someplace. The fact that you drank a lot of water and it got a little bit better tells me that there's an inflammatory component to it, because if you're drinking alkaline water and the pain begins to subside, tells us that you have inflammation. By definition, that's what you're treating when you're doing that.
Okay. Now, it's not only the knees. It went from the knees to, like, everywhere.
So it's all over your body now?
Yes.
All right. Okay, so if you have pain that is kind of all over the place, it can be for a lot of different reasons. It can be from toxic overload in your system. It can be a systemic inflammatory response that can come from your intestinal tract. You could have abnormal bacterium. Your spinal system could be not balanced properly, your energetic system. But unless, trying to figure out exactly what it is without a full detailed examination, muscle function testing, and doing some adrenal pathway tests is difficult. Now, but what I can tell you, because of what you're describing, is one, that it is inflammatory. Two, that obviously your body weight for someone who's 5'5" at 210 pounds, unless you're in the best physical condition of someone, your age and your weight, that weight is contributing to it. It's making it a whole lot worse. And you're going to have to...
The challenge is getting rid of it. That's hard to...
Well, you can do it. You just have to, if you pay attention to the show today, and I'm going to go through the steps of how to increase your wellness index, but here's the deal. If you have to begin to eliminate consumption of the things that will inflame your body to begin with. What are those? Anything that is a refined grain, number one. Sugars, grain, wheat, any kind of wheat or gluten. Get it out of your diet 100%. The next thing you want to do is eliminate sugars. And if you're a soda drinker, I don't care if it's diet or otherwise, get rid of it. Get rid of black coffee unless it's organic Kona, and then only have 1 cup a day. Black tea, the only teas you should be drinking is green tea. Anything that has a refined process to it. You want to go to whole live types of foods. You want to get rid of the additives and the preservatives. Those things have got to go. You want to get rid of dairy products, because dairy products...
I've pretty much done that, except I am doing coffee with milk or cream.
Yeah, get rid of it.
You said what coffee was okay?
If you can get 100% organic Kona coffee, you have to buy it online. It's going to be
organic Kona coffee.
Kona, Kona, and then 1 cup a day only in the morning while you're going through this process. I would encourage you to eliminate it totally, because it's going to be inflammatory just because of the oils that are in the coffee. Some coffees, if you were healthy, you could tolerate, but in this situation, with the type of problems that you have, you can't. The next thing you need to do is you really need to be examined by somebody who knows how to do what we do. You have to look at adrenal pathway function. You have to look at heavy metal toxic pathways. You have to look at spinal alignment. You have to look at acupuncture energy and so forth. Those things will make a difference. And Jay, if you follow through with that, there's an answer. There is a why is that. Give me a call or go on the website at rosellecare.com. Send me a note, and I will go back and forth with you to try to work this out and tell you what I would suggest. But I appreciate your phone call. We're here at 888-630-9625. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I'm in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. Anything that you have on your mind that you haven't been able to work out relative to your health, well, here's your opportunity. This is the place where we fix it without drugs, without surgery, without all the nonsense of the side effects that you end up with by taking some of those silly things over a lifetime in so many cases. And those of you who attended Ageless Health 2012 yesterday know that it was over the top. It was the best production of the 12 years we've been doing it. We had a full house. It was a great day. Hopefully those of you who have not had the opportunity to join us will the next time that we do it. We'll let you know, obviously. And please go to our website at rosellecare.com. That's ROSELLECARE.com. And check out the different learning opportunities that you have. We have an in-house continuing education program that we do every other week. The topics are listed to the end of the year. We have some special events that are taking place. We created a new website for you called drtomroselle.com, DRTOMROSELLE.com. And it's set up for interactive learning. There's going to be webinars on there, and you can sign up for newsletter, you can blog, you can all kinds of things. Anyway, go check it out. Let us know what you think, and give us some suggestions of things that you'd like to see there, for your educational well-being and also increasing your health and wellness index at a very, very high level. 888-630-9625. Love to talk to you. Let's talk about the steps of increasing your wellness index. Well, we talked about clean diet, right? We talked about making sure that you put the fuel in your body that you need to maintain that engine, that vehicle called you. Sue yesterday on the platform said, when you eat junk, it's a whole lot like putting kerosene in your car tank. It's just not going to run really well. So when you put garbage in your body, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preserves, my mantra, stay away from that stuff and shift to things that are colorful. Your plate should look like a kaleidoscope of colors, and your proteins should be a small portion of your meal. You need proteins, and you need proteins every time you eat something, but they should not be the overwhelming piece. You shouldn't sit down and eat 1.5 pounds of steak. You need to have a few ounces of meat and a lot of vegetables on your plate. That's what really runs the ship. That's what makes you stable. That keeps the inflammation down. That keeps your glycemic level, your insulin under control. Without taking control, without, if you go out and you catch as catch can, you go to the fast food places, you grab somebody's French fries, and you get somebody else's milkshake, and that's not the way your body was designed to run. So clean your diet up. It only takes a few easy steps. Start drinking water. Alkaline water is better. And there was a gentleman that I was going back and forth with, and he said, well, I drink distilled water, and it's the best water out there. Well, it really isn't. Distilled water is great for detoxification. It's good for combining other products that you want to put into your body, homeopathic preparations and so forth. But long-term use of distilled water can cause problems. Why? Because it's an unbalanced charge. It's got to glom onto something. It locks onto calcium and other minerals, begins to pull them out of your body. Subsequently, you could go into heart fibrillation, and that's not a good thing because it could stop your heart. So long-term use of distilled water is not good. But if you're doing a short-term process, you want to detox, you want to clear out some of the garbage, you can do that, and you can use it for a week or 2 or 3 or a month, but then you have to make sure that you stop the process and go back to at least a neutral water, which is a pH of 7, filtered properly, getting about 99% of all the junk out, and make sure you're flushing your system adequately. So water intake is another piece of this, and put some lemon in it, put some lime in your water. You want to make sure that you avoid dairy. Why dairy? Why? Have you been taught by Fifth Avenue marketing that dairy is good for you? Not so much, unless you can get raw milk, particularly from a goat or a sheep, because it's more like mother's milk. But dairy is inflammatory. It's acidic, and you have to really stay away from the processing. Cheeses that are made by the fermentation process and putting mold and yeast in them are not good for you. The only cheeses that you really can get away with occasionally are raw goat and sheep cheeses, basket cheeses, mozzarella, the buffalo mozzarella, but they still have to be natural raw cheeses, because otherwise the processing, the pasteurization process also breaks them down. What it does, it changes the chemical structure of the dairy product from a covalent bond in its calcium formation to something that is an ionic bond. And what does that mean? It just means that it can't get into your system easily. So don't be fooled by marketing and think that you have to have a glass of milk every day. It's inflammatory, it's mucus forming, it's not going to serve you well. The next step is you want to build a healthy intestinal tract. You can put good stuff in, but if you can't break it down, it doesn't make any difference anyway. It just kind of goes to waste. You have to make sure that your intestinal system is healed. Dr. Lamp yesterday used the analogy that if you have a system that is inflamed, that's irritated, you're basically closing the windows. You can't get anything through anymore. The receptor sites are blocked. So if the gut is inflamed, several things happen. That's one thing that happens, but the other thing happens, it cracks. It becomes like a sieve. So things aren't digested fully. And so your body reacts to these big things that are coming in, and the body doesn't like big things. It sets up an alarm. It sets up inflammatory responses to go after these big undigested particles that go into your system. You have to chew really well. Slow down when you eat. Enjoy the process. Don't be stressed out. If you're watching the Stupid Tube and listening to the talking heads at night while you're eating your food and they're cranking you up and you're getting mad, that's called a sign, a clue that you really shouldn't be eating at that time, or at least turn the tube off and put on some music and relax a little bit, something nice and soft in the background, and have a gentle conversation. Don't get into an argument with anybody, because at that point your body's going into fight-flight. You're going to start pushing adrenaline into your muscle tissues. Your stomach stops producing the digestive chemistry, the enzymes that it needs to have, and things kind of rot, and you go into stress and more inflammation, and it's not worth it. So how many of you, listening to this, realize that maybe this is something that you do that you can eliminate, you can change? How about relaxation? How about just kind of gentle yoga or tai chi? Something that is very, very soft and soothing and a well-balanced process of brain and body. Those two things, if you didn't do anything else, and if you learn how to meditate a little bit, or prayer, it doesn't make any difference which you choose. But, for many of us, for me, it's a meditative prayer state that I go into, and I allow things just to calm, and my life is crazy. It's a very, very stressful pattern. So how do I get through it? How do I deal with it? Well, I take time for myself. I take time to lock into the things that are good and supportive and fruitful in my life, and go into a constant state of gratitude. Not a lot of us do that. Whether you have $1 in your pocket, and I used this on stage yesterday, or you have $100 million, be grateful for where you are, because the more you are in a state of gratitude, the more you draw to you similar situations, decreasing your stress. Don't look on lack. Don't look at what you don't have. Look at what you do have and would like to add more to that pile. Stress reduction is so important when we're trying to build our health and our wellness index. If we are in a constant state of tension and stress and locking our jaws down and tightening our muscles up, or it just, it takes us in the opposite direction of where we want to go. 888-630-9625, that's how you reach me here. And how you find me off the air is you go to rosellecare.com. That's ROSELLECARE.com, and send me a note. I will answer you, and we'll get back to you as rapidly as we can. If you need to have immediate attention to something, give our office a call at 703-698-7117. Tell my staff that you'd like to have one of our practitioners call you back, and tell them briefly what it's about, and one of our guys will call you and talk to you and try to get some understanding around the problem, the process, and if we can be useful to you, we're more than happy to do that. That's why we're here. You need to understand how the rhythms of your body work. You have to understand that there's a nighttime rhythm. You have to understand that there's a daytime rhythm. Those of you who like to stay up all night long are really messing with the circadian rhythm of hormone production and your deep, restful REM type of pattern. Sleep should be unmolested, if you will. And what do I mean by that? It's very simple. No lights, no noises, not a room that's too hot, should be actually slightly cooler, and should be no disturbances. If somebody's next to you snoring up a storm, well, you know what? You better go in the other room and try to get a good night's sleep, because if you're being disturbed all night long and you're not getting your sleep, well, then your body's immune process, your inflammatory levels are going to skyrocket. They're going to go right through the ceiling, and you're not going to be able to fix anything. So get a good night's sleep, and sleep well and long. What do you mean? Well, if you're in great shape and you feel good, you probably can get away with 6 hours, maybe 7. Some of you need that 8 hours, 8.5 hours of unmolested sleep, something that you can just zone out, stay there, not get up. If you're having problems with a guy's prostate problems where he's getting you up during the night, that can be reversed. You can change those things. You can change it without medication, providing that you're willing to do some of the things that we're talking about. You got to change the diet. You got to lower the stress index. You've got to do something different. The prostate is 50% zinc. The dry weight of the prostate is 50% zinc. As we get older, because of our stresses, we burn zinc up like crazy, particularly something called zinc sulfate, which is the one that seems to have the best reaction within the prostate. There are other things, pygium and so forth, that are very good in restoration of prostate function. But you have to also remember, things that affect the prostate, guys, are the same things that affect women's health and the breast tissue, because it's genetically the same, and vice versa. That which affects the breast affects the prostate. We're seeing more and more problems today with prostate function in men, including cancers. Why is that? Because of our exposures, the things that we're putting into our body, the xenoestrogens, meaning outside estrogen sources that affect our body. We have to be able to handle that. We have to be able to blunt that. But because of the sugar, sodas, coffee, teas, etc., because of the radiation exposures, because of the electromagnetic fields, because of our diets not being as supportive as they should, things that we need to have that we don't put as much into our body as we should, we become susceptible. We become a terrain, an environment, a garden bed waiting for something to be put into it that's not normal. We need to change the terrain. We need to change our habits. We have to decrease that stress pattern and begin to break things down. You know, so many of you go to your docs and you get some blood work done. And they say, well, my doctor said everything's fine. Well, I take a look at that same blood work and I start telling you everything's not so fine. See, we have a bad habit of listening to textbooks. And nothing is a textbook. You are not a textbook. These are suggestions. They're parameters. Functional medicine doesn't work that way. Functional medicine looks at the numbers as they relate to the patient. So when you have, for example, a laboratory that says that a white blood count should be between 4,000 and 11,000, and if you're within that range, it's normal. My head, after all these years of practice, goes back to what I knew years ago when 5,000 to 8.5 to 9,000 were normal. How come those ends got larger? Why did it go from 5 to 4? Why did it go from 8, 5, 9 to 10 or 11? Well, see, what they're seeing is that there's more people who are ill and sick and not in the parameters, so they're considering that normal. Not so much. Anything under 5 says that you have an immune suppressive problem if it shows up repetitively. Anything above 8, 8.5 tells you have an acute reaction to something. It can be an infection, it can be an exposure, but that's a heads up. So you have to look at functional medicine and base it on your symptomological presentations. You go to your doc and the thyroid stimulating hormone, has a range of like 0.57 all the way up to 5. Well, functional medicine range is 1.8 to 2.2. Anything above or below that tells you a different story. You have to understand that there are differences. And we talked about that on stage yesterday. We talked about where the parameters should be. Dr. Jennifer Sims, as she was talking about female hormones, was talking about the specificity of understanding what those things mean. And if you don't understand them, if you don't really put them in connection with what you're seeing in front of you, then nothing else works. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I've been in studio broadcasting to you from 105.9 FM and AM 630 WMAL. Always a pleasure to talk with you. Always a pleasure to give you more information so you can help yourself. We're here for your listening pleasure and education and motivation and to try to make a difference in your life. Let's go to the phones. Joyce, how can I help you?
Oh, thank you. I went to my doctor to have a mammography test.
Yes, ma'am.
And I'm under Medicare. And then the woman said to me that for $50 more, I could have a 3D breast exam. Now, is that what you talk about
No.
when you talk about mammography? What is the difference?
No, thermographic imaging utilizes a infrared thermographic camera that registers a heat signal from the breast tissue, where mammography of any sort is radiation, so it's radiation exposure to you. Thermographic imaging does not do that. What thermographic imaging does, for example, let's just put it in a very, very straightforward way. For you to have a breast tumor, you have to have a blood supply. And the blood supply goes to the tumor well in advance of the formation of the tumor. So you can pick up the beginning stages of cancer with a thermographic imaging far in advance and much earlier than mammography does. It's an FDA-approved procedure, and it doesn't damage the breast. If you've had 5 mammograms, you've increased your risk of cancer to the breast tissue by 40%.
I see.
That's just the data. So, I mean, you think about what's being done. You're taking this very gentle, soft tissue, you're crushing it in a vise, and then you're radiating it, right? So
yes.
you're going to damage it. So if you have, and then what happens is there's a group of physicians, medical guys, that's all they do is they read these things all day long. And if they see something that's suspicious, then what they say, okay, it's time to do the next test, and that they're going to recommend either ultrasound or MRI, but there's too many false positives with an MRI, with a mammogram. Way too many. So for my money, for my wife's health, we only use and recommend thermographic imaging. Now, you can go on site, go to thermographycenters.com, and they have a lot of information there that can lead you to making that decision. But the two procedures are very different, and one is much safer, in my opinion, than the other. But check it out, and if I can be useful and helpful to you, let me know. 888-630-9625. That's 888-630-WMAL. Wish you would have joined us yesterday. It was a great day. It really was over the top. Getting back to our steps to maximizing your health, you have to incorporate things that are positive in your life. Good diet, understanding what your body's really trying to tell you. You have to utilize things that are immune-enhancing, acupuncture, chiropractic care, good nutritional procedures, supplementation. You need to know your supplements. You can't just go to, your local pharmacy or discount house and buy supplements, because so many of them are artificial. They're not natural sources. You get a B complex or omega-3 fatty acid. You got to ask yourself the question, where does it come from? Where was it derived from? Is it something that I really want to put into my body or not? Exercise daily. Do something for yourself, stretch, walk, or do something every day. If you just do those things that we talked about, watching your sleeping habits, eating properly, exercising well, and do it incrementally, slowly over a period of time, you will get progressively stronger and better. And as always, if we can be of use to you and to help you in any way, you go to RoselleCenterForHealing.com, send us a note. If we can help you with evaluations, you do that as well. We're here every Sunday at 12 noon, bringing you the most up-to-date information possible in the area of natural health care. This is Dr. Tom Roselle. Bye.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.